2 people called in sick and there was just the 2 of us on for most of the night.
Irrelevant. 2 litres, 6 litres. Tell me why the difference matters.
Patients with chronic respiratory disease grow accustomed to low levels of oxygen in the bloodstream. Giving them a high concentration of oxygen abolishes the drive to breathe.
You didn't correct the oxygen flows because you didn't recognise the dangers. That's how this woman died. Dr. Maitland? All right, send him over to coronary care now.
Did Pam say anything to you about Mrs. Mansfield?
What's this about Pam?
People are saying she's got a history of mental illness.
What? She had counselling for depression when her twin sister was killed, that's all.
Got you now, Dr. Raja.
Oh, crap accent, James. No. You know, I still don't remember the girl with the red dress you're supposed to have pulled.
I can't really discuss it because the lady in question's already spoken for. There's nothing more frustrating than getting off with someone and not being able to brag about it.
The affair between John F. Kennedy and Marilyn Monroe, for example. Imagine the strain of having bedded the world's greatest sex symbol and being bound by office to keep it to yourself.
Got so much for him, his head simply exploded.
1963, yeah? I was SR to Professor Sir Quentin Jarvis. Best damn surgeon I ever knew.
Except when you look in the mirror, eh, Mr. D?
Oh. You and your secretary make a nice couple, Mr. D.
Thank you. Of course, in my day, hospital socials were much more of a... Oh, you guys would never have stood the pace. I remember the ball for the new fellows at the Royal College in 1959. I drank 20 pints of beer, 5 large vodkas, drank a pint of seawater, stuck my fingers down my own throat, was swung around Barrington Smythe's head and ended up sick as a dog. But that was in the day before we had invented bloopers, you see. Each hospital had a kennel of bloodhounds, and each dog was trained to identify the particular doctor's scent. So, when that doctor was required, the dog was dispatched to track him down. Oh, I can remember how.
Catch you later, Mr. D.
I'll see you, Mr. D.
See you. Good afternoon, scissors. What delights await us? What's the matter? Cat got your tongue?
Mr. Dockley, don't you remember your list has been given to Mr. De Vries?
Sorry, Ernest.
Oh, forgive me. Force of...
There's this bloke, and he's been marooned on an island for 10 years or so. Hasn't seen a woman or had sex in that time, well over that time. Anyway, he's walking along the beach this day, and there, washed up on the shore, is a woman. So he rolls her over. It's Claudia Schiffer. Can't believe his luck. So anyway, gets her up to the hut, gets a few coconut juices down her neck, and before you know it, one thing leads to another, and world-class pumpage all night. But he wakes up in the morning and he's really, really miserable. She says to him, she says, "What's wrong?" He says, "Oh, I was wondering if you could do me a favour." She says, "Yeah, sure." He says, "I was wondering if you'd, cut all your hair off really, really short." So she says, "Yeah, sure." So she does that. So he said, "I wonder if you could do one more thing for me." She said, "What?" So "I want you to put on all my clothes." She said, "What, wear men's clothes?" He said, "Yeah." So she puts on all his clothes. She goes, "God, with this short hair and everything like that, I look like a bloke." He goes, "Great, that's exactly what I want you to look like." So he said, "Just do me one more favour. Will you go wandering off down the beach for about 400 or 500 yards? So she does that. Anyway, next minute, the bloke, he goes screaming up the beach towards her, beaming with this huge smile on his face. He goes, "Oi, mate, you'll never guess who I'm shagging."
Ha, ha, ha. The mess you're making of this femme distal shows your true talent for comedy.
I wasn't aware that I was messing up.
And just keep your mind on the job. That's something you can manage. Being on the job.
OK, we're just moving you to another cubicle so that the doctor can see you, Mr. Crichton.
Brigadier.
Oh, excuse me.
A lot of fuss and nonsense about nothing. A twinge of indigestion after a difficult session at the magistrate's court. Could happen to anyone. Am I safe here, nurse?
Well, we do our best, Brigadier.
The first bit of illness of my life. And those private insurance blinders say I'm not covered because the premium was late.
How annoying
Oh,
for
I
you.
do hope this is not some sort of ramshackle setup.
His STs are up in 2, 3 and AVF.
What's all this gobbledygook?
The heart tracing suggests that you may well have had a heart attack, sir.
Well, I'll not be wanting any black magic remedy.
James Parker was suffering from hypertrophic obstructive cardiomyopathy.
An abnormality of the heart muscle, often affecting otherwise fit young people, but nonetheless leaving them at high risk of sudden death.
And the puncture marks on his arm were because the second on-call sent off some routine bloods.
Yes, right. But this doesn't get anyone off the hook for Mrs. Mansfield.
Off the hook? Now, look! I said... you heard me, Graham. I said no witch hunts.
I have a list here of 7 factors highlighting staff negligence in this case. Factor 1, poor communication between staff nurses and doctors. Factor 2...
Winnie Mansfield was murdered by people who cut our costs to the bone, forcing us to employ too few staff with too little training.
Factor 2, nursing staff's overindulgence in sick leave.
Gone private all my life. The National Health, well, it might serve Joe Public. But you lot are too busy running around like headless chickens to provide a fellow with the attention he requires. What's this contraption here, young lady?
The indications are that you've had a heart attack. The drip is to dissolve the clot in your coronary artery.
Yes, well, I'd prefer a more private room. And I want to see the consultant forthwith.
What you want right now is bread and butter national health medicine.
Factor 6, duty rota is being altered without consultation. And Factor 7, note-keeping incomplete and uncontemporaneous.
Claire, anyone I should see before I go?
No, we're taking over like a Swiss watch, Dr. Turner.
Good show. Bye.
Dr. Maitland, I consider it unprofessional of you to be taking beverages while dealing with patients.
Well, I'm too busy with my job to take a tea break.
I know your schedule is a hectic one, Doctor, but I'm sure you would want your patients to consider that your deportment detracts in any way from your usual high professional standards.
Would anybody like to register their offence?
You took a pint of milk for the doctor's mess. If the account is not settled by the end of the week, further action will be taken.
The district managers have expense accounts that run into thousands of pounds. The region's just blown 10 million quid on a computer system that can't add 2 + 2. I'm sure Claire's great milk robbery is going to undermine the entire NHS budget. I'm not here. This is the half day that keeps my hours in the limits you keep bragging about. I must have gone home and not realised it.
Dr. Collin, I shall be speaking to you shortly about your unfounded objections to covering ear, nose and throat. You will settle your account with hotel services. Good night.
Alf. Just came to say goodbye.
Thanks, son. Thanks for everything. Bad luck about Winnie Mansfield, wasn't it?
Yeah. Did you get to know her?
Well, no, not really. Some nights I used to have a chat with her niece when she came in to tuck her up. You know, the one that's the night nurse on the other ward.
She'd do a few things to make her aunt more comfortable, wouldn't she? Save bothering the staff.
Oh, she's a good girl.
Like, if Winnie was feeling short of breath, she'd turn up her oxygen.
Oh, aye.
Good luck, Alf. Don't let me see you back here in a hurry.
You and De Vries?
Yeah.
Can't believe it. It's even harder to believe than you and me. You've got a face on you tonight like a slapped ass.
Just wonder what it would be like to have a normal life. Not to be tired all the time. Gotta go.